When Sergeant Alexei Volkov first saw the German field surgeon washing his hands with soap before treating wounded prisoners, he was certain it was some kind of elaborate torture ritual. After months of battlefield medicine, where vodka was the only disinfectant and dirty rags served as bandages, the sight of sterile instruments and clean white coats seemed impossible. What happened next would shatter everything these Russian soldiers believed about their enemy. As the German surgeon methodically cleaned each instrument with alcohol, then arranged them on a pristine white cloth, Volkov's confusion deepened. In his unit, the same rusty knife had been used to cut bread, clean boots, and dig out bullets. The idea that medical tools required special treatment seemed like an elaborate waste of time until he saw what happened to the patient who went before him. The wooden doors of the medical barracks had swung open with an almost ceremonial precision, revealing a space that defied every expectation the Russian prisoners had formed about German brutality. Bright electric bulbs cast harsh light across whitewashed walls, illuminating rows of metal tables covered with impossibly clean sheets. The air itself carried an unfamiliar sharpness, the smell of carbolic acid and medicinal alcohol that burned their nostrils after months of breathing the putrid atmosphere of untreated wounds and unwashed bodies. Volkov stood among 30 other prisoners, their torn uniforms and bandaged limbs a stark contrast to the clinical environment surrounding them. Many clutched infected wounds through makeshift dressings, having grown accustomed to the constant throb of untreated injuries. In the Soviet army, medical care had been reduced to its most primitive elements. Soldiers either survived their wounds through sheer endurance, or they didn't. The concept of systematic medical treatment seemed as foreign as the German language being spoken around them. A German medical officer approached the group, his uniform bearing the distinctive Red Cross insignia. Unlike the harsh barking of combat soldiers, his voice carried a measured professional tone as he addressed them through an interpreter. The prisoners would be examined, treated, and housed in the medical facility until their wounds healed properly. Historians still debate whether this medical care for enemy prisoners represented genuine humanitarian concern or strategic necessity to maintain a productive workforce. The systematic approach began immediately. Each prisoner received a numbered tag and was directed to a specific examination area. German medics moved with practiced efficiency, consulting charts and recording observations with methodical precision. For men accustomed to the chaos of battlefield medicine, where treatment depended on ammunition supplies and the medic's survival, this organized approach seemed almost supernatural. Volkov watched as his comrades were processed through the medical evaluation system. Some had been carrying infected shrapnel wounds for weeks, having received only the most basic field dressing before capture. Others displayed the telltale signs of trench foot, frostbite, and malnutrition that had plagued the Eastern Front throughout the harsh winter months. The German medical staff examined each condition with clinical detachment, making notes and issuing immediate treatment orders. The contrast became even more pronounced when Volkov observed the medical equipment arranged throughout the facility. Glass cabinets displayed surgical instruments that gleamed under the electric lights, their surfaces polished to mirror-like perfection. Bottles of clear liquids lined shelves with German labels, indicating various antiseptics and medications. Everything appeared to have been manufactured specifically for medical use, rather than improvised from available materials, as had become standard practice in the Soviet forces. Take a moment to like the video and subscribe, but only if you're genuinely enjoying what we're uncovering here. The revelation these Russian soldiers experienced was about to challenge everything they thought they knew about modern warfare and medical care. The cultural divide between Soviet and German medical practices became starkly apparent as the examination process continued. In the Red Army, medical treatment had been stripped down to its most basic elements through years of resource scarcity and battlefield pragmatism. Field medics carried leather pouches containing bandages torn from clothing, bottles of vodka for disinfection, and perhaps a rusty pair of forceps salvaged from abandoned medical supplies. Pain management consisted of biting down on leather straps or wooden sticks, while comrades held the wounded soldier still during crude surgical procedures. German medical protocols, by contrast, followed systematic procedures that seemed almost ritualistic in their precision. Before touching any patient, medical personnel scrubbed their hands with soap and alcohol, then donned clean white coats that were changed regularly throughout the day. Instruments underwent sterilization processes using boiling water and chemical disinfectants, ensuring that each tool met specific cleanliness standards before use. This attention to hygiene represented a fundamental difference in medical philosophy that the Russian prisoners struggled to comprehend. Volkov observed a German surgeon preparing for a minor operation on a fellow prisoner's infected leg wound. The doctor spent nearly 10 minutes washing and preparing, arranging instruments in precise patterns, and checking supplies before making the first incision. In contrast, Volkov remembered watching Soviet field medics perform similar procedures with unwashed hands, using whatever sharp objects were available, often while under enemy fire. The German approach seemed wastefully slow, yet the results spoke for themselves when he noticed the absence of screaming from the operating table. The facility's pharmaceutical supplies further highlighted the disparity between medical resources. German medics had access to manufactured medications with specific dosages and applications, stored in labeled bottles and administered according to written protocols. Soviet medical practice relied heavily on improvised remedies, tobacco leaves for wound dressing, alcohol for everything from disinfection to anesthesia, and herbal treatments learned from peasant traditions when formal medical supplies ran out. Russian prisoners whispered among themselves about the abundance of medical materials they witnessed. Rolls of clean white bandages sat stacked in supply cabinets, while bottles of antiseptic lined shelves in quantities that would have supplied an entire Soviet field hospital for months. The Germans appeared to treat medical supplies as standard equipment rather than precious resources to be rationed and conserved at all costs. The systematic record-keeping also puzzled the Russian soldiers. German medical staff maintained detailed charts for each patient, documenting symptoms, treatments administered, and recovery progress with meticulous handwriting. Soviet medical practice, when records existed at all, consisted of crude notes scratched on whatever paper could be found, often discarded when units moved to new positions. The idea that enemy prisoners warranted such detailed medical documentation seemed incomprehensible to men accustomed to being treated as expendable resources. Language barriers complicated the medical examinations, but German staff had prepared for this challenge with interpreters and visual communication methods. Russian prisoners found themselves attempting to describe symptoms and medical histories through gestures and broken phrases, often discovering that German medics possessed medical knowledge that surpassed anything they had encountered in Soviet military hospitals. Historians continue to debate whether German medical superiority during this period resulted from better industrial resources, different military priorities, or fundamental differences in how the two armies valued individual soldier welfare. The evidence preserved in prisoner testimonies suggests that German medical infrastructure had been developed with long-term strategic planning, while Soviet medical systems had adapted to chronic shortages and rapid mobilization demands. The psychological impact of witnessing superior enemy medical care created cognitive dissonance among the Russian prisoners. Propaganda had prepared them to expect brutality and neglect from German captors, yet their immediate experience contradicted these expectations. Some prisoners began questioning whether other aspects of Soviet wartime narratives might prove equally inaccurate when confronted with direct observation. Volkov's turn for medical examination arrived with the efficiency of a factory assembly line. A German medic gestured for him to approach a metal table covered with a crisp white sheet that showed no stains or previous use. The sergeant hesitated, clutching his infected arm against his chest, remembering the screams that had echoed through Soviet field hospitals when wounded soldiers underwent treatment without proper pain relief. His expectation of agony was about to encounter something that would fundamentally alter his understanding of medical possibilities. The German doctor began by examining Volkov's wound through the torn fabric of his sleeve, speaking softly in German while making notes on a metal clipboard. Unlike the hurried, rough handling he had experienced from Soviet medics operating under combat pressure, this examination proceeded with methodical gentleness. The doctor's hands moved carefully around the infected area, testing for inflammation and checking circulation with movements that seemed designed to minimize additional pain rather than simply complete the task quickly. When the doctor indicated that Volkov needed to remove his shirt for a thorough examination, the Russian sergeant complied with growing anxiety. The infected shrapnel wound in his shoulder had been festering for 3 weeks, treated only with strips of cloth torn from a dead comrade's uniform and occasional splashes of whatever alcohol could be spared from rations. The smell of infection had become so familiar that Volkov no longer noticed it, though the German medical staff certainly did, based on their facial expressions. The revelation began when the German doctor reached for a small glass bottle containing clear liquid and a peculiar rubber mask connected to tubes and gauges. Volkov had never seen such equipment before, and his confusion grew as the doctor explained through gestures that this would help with pain during the procedure. In the Red Army, pain management consisted of biting down on leather straps, drinking vodka if available, or simply enduring the agony while fellow soldiers held the patient still. As the doctor placed the rubber mask over Volkov's nose and mouth, the Russian sergeant prepared for the worst. The sweet-smelling gas flowing from the apparatus seemed like another form of torture, perhaps designed to suffocate prisoners during medical procedures. Soviet propaganda had suggested that German efficiency extended to eliminating wounded enemy soldiers through seemingly medical means. Volkov's last conscious thought was a mixture of terror and resignation as consciousness slipped away. The awakening proved more shocking than the anesthesia itself. Volkov regained consciousness to find his shoulder professionally bandaged with clean white dressings, the infected wound cleaned and treated with antiseptic solutions that left his skin tingling rather than burning. No pain accompanied his return to awareness. Instead, he felt a strange lightness where the constant throb of infection had dominated his existence for weeks. The German medical team had performed surgery while he slept peacefully, experiencing no pain whatsoever. Sitting up slowly on the examination table, Volkov discovered that the German medical staff had not only treated his primary wound, but had also addressed several minor injuries he had forgotten about during the chaos of combat and capture. Small cuts had been cleaned and bandaged, bruises treated with cooling ointments, and his overall physical condition assessed with thoroughness that exceeded anything he had received in Soviet military hospitals, even before the war began. The psychological impact of painless surgery challenged fundamental assumptions about medical treatment that Volkov had accepted throughout his military service. Soviet soldiers were taught that enduring pain demonstrated strength and loyalty to the cause, that suffering during medical treatment was both inevitable and character-building. The possibility of surgery without agony seemed to undermine these core beliefs about the nature of medical care and personal endurance. Other Russian prisoners who had undergone similar procedures shared their amazement in whispered conversations throughout the medical ward. Men who had entered the facility expecting torture or death found themselves recovering from surgeries they couldn't remember experiencing, treated with medications that eliminated pain rather than simply masking it temporarily. The sterilization procedures that had initially mystified Volkov began to reveal their purpose as he observed the German medical staff's methodical approach to instrument preparation. Every morning, Medical personnel arrived early to begin the ritual of cleaning and preparing surgical tools according to strict protocols that seemed almost religious in their precision. Instruments were first scrubbed with soap and hot water, then submerged in boiling solutions, and finally arranged on sterile cloths with specific spacing between each tool to prevent contamination. This systematic approach to medical hygiene contrasted sharply with Soviet battlefield medicine, where the same instruments might be used on multiple patients without cleaning, often transferring infections from one soldier to another. Volkov recalled watching their unit's medic use a single pair of forceps to remove shrapnel from 3 different wounded men during a particularly intense engagement, wiping the tool on his uniform between patients when time permitted. The concept that medical instruments required individual sterilization for each patient seemed wastefully time-consuming until he witnessed the results. German medical orderlies maintained supply stations throughout the facility where sterilized instruments were stored in glass cabinets, protected from dust and contamination until needed. Each cabinet contained duplicate sets of surgical tools, ensuring that operations could continue even while other instruments underwent cleaning and sterilization processes. The abundance of medical equipment impressed Russian prisoners who had grown accustomed to sharing medical supplies across entire companies. The sterilization process extended beyond surgical instruments to include bedding, bandages, and even the clothing provided to patients during recovery. Volkov noticed that bed sheets were changed regularly and replaced with freshly laundered linens that smelled of soap and disinfectant. Bandages came from sealed packages rather than reused cloth strips, and patient gowns were distributed from clean supply stocks rather than improvised from available fabric materials. Alcohol-based disinfectants played a crucial role in German medical protocols, used not only for cleaning instruments but for sterilizing surfaces, hands, and wound sites before treatment. The Russians observed German medics cleaning examination tables between patients, wiping down surfaces with antiseptic solutions, and washing their hands multiple times throughout each medical procedure. This attention to cleanliness seemed excessive to soldiers accustomed to battlefield conditions where hygiene was a luxury rarely afforded. The psychological effect of witnessing such thorough sterilization procedures gradually shifted from confusion to grudging respect among the Russian prisoners. Men who had initially dismissed German medical protocols as unnecessarily complicated began to notice the absence of secondary infections and complications that had plagued Soviet medical facilities. Wounds treated in the German facility healed faster, and with fewer complications than similar injuries treated under battlefield conditions. Volkov's own recovery provided concrete evidence of sterilization effectiveness. His infected shoulder wound, which had resisted healing for weeks under improvised Soviet medical care, began showing improvement within days of German treatment. The absence of additional infection despite the invasive surgical procedure demonstrated the practical value of systematic instrument sterilization and wound care protocols. Historians debate whether German medical advantages resulted from superior industrial resources or different military priorities regarding soldier welfare. Evidence suggests that German medical doctrine emphasized preventing infections and complications that could remove soldiers from active duty for extended periods, while Soviet medical practice focused on returning wounded personnel to combat as quickly as possible, regardless of long-term health consequences. The contrast became particularly evident when Russian prisoners compared notes about their medical experiences before capture. Stories emerged of Soviet field hospitals where infection rates approached 50% among surgical patients, where gangrene claimed more lives than original wounds, and where medical supplies were so scarce that basic antiseptic procedures were considered luxury treatments reserved for officers. German medical efficiency extended to waste management and contamination control, with systematic disposal of used materials and regular cleaning of medical facilities that maintained sanitary conditions even under the pressures of wartime operations. The introduction to German medical technology began when Volkov was escorted to a separate room containing equipment that seemed to belong in a science fiction narrative rather than a prisoner of war medical facility. The centerpiece was a massive machine with mechanical arms, electrical cables, and a table that could be adjusted to various positions with the turn of metal cranks. German technicians operated the device with practiced familiarity, but to Russian prisoners who had never encountered X-ray technology, the apparatus appeared mystical and potentially dangerous. A German technician positioned Volkov behind a large metal plate and instructed him through gestures to remain perfectly still while the machine operated. The mechanical whirring that followed, accompanied by electrical humming and occasional clicking sounds, convinced many Russian observers that they were witnessing some form of advanced torture device. Soviet propaganda had suggested that German technology focused primarily on developing more efficient methods of inflicting pain and extracting information from captured soldiers. The revelation came when the technician developed the X-ray film and displayed the ghostly image of Volkov's internal bone structure on a lighted viewing screen. The sergeant stared in amazement at what appeared to be his own skeleton, clearly showing the location of shrapnel fragments that had been causing pain for weeks. German medical staff used the images to plan surgical procedures with precision impossible under Soviet medical conditions, where surgeons relied entirely on external examination and educated guesswork about internal injuries. Other diagnostic equipment throughout the facility demonstrated technological sophistication that impressed even skeptical Russian prisoners. Microscopes allowed German medics to examine blood samples and identify specific infections, leading to targeted treatments rather than the broad-spectrum remedies used in Soviet field medicine. Electrical devices monitored heart rates and blood pressure, providing quantitative measurements that guided medical decisions with scientific precision rather than intuitive assessment. The German medical facility included laboratory equipment for testing biological samples and preparing specialized medications tailored to individual patient needs. Russian prisoners observed technicians mixing chemical solutions, analyzing specimens under powerful magnification, and consulting reference materials to determine optimal treatment protocols. This systematic approach to medical diagnosis contrasted sharply with Soviet battlefield medicine, where treatment decisions were based primarily on visible symptoms and general medical knowledge. Communication equipment connected the prisoner facility with larger German medical installations, allowing local staff to consult with specialists and access medical expertise unavailable in isolated field hospitals. Volkov watched German doctors discussing his case over telephone connections, describing symptoms and receiving guidance from unseen medical authorities who had access to broader knowledge and experience with similar injuries. Electrical power throughout the medical facility enabled consistent lighting, refrigeration for medications, and operation of diagnostic equipment that required stable energy sources. Russian prisoners had grown accustomed to medical facilities operating by candlelight or oil lamps, where refrigeration was impossible, and most medical procedures depended on daylight hours for adequate visibility. The abundance of electrical power suggested industrial capacity that far exceeded Soviet wartime capabilities. Historians continue to examine whether German medical technology represented fundamental advances in medical science or simply better resource allocation for military medical infrastructure. Contemporary accounts from Russian prisoners suggest that much of the equipment they encountered was standard in German military hospitals, rather than specialized technology developed specifically for prisoner treatment. The psychological impact of witnessing advanced medical technology created lasting impressions among Russian prisoners who had expected primitive conditions in captivity. Men who had dismissed German industrial capacity as propaganda began reconsidering their assumptions about relative technological advancement between the two military systems. The medical facility served as an unexpected window into German industrial and scientific capabilities that challenged Soviet narratives about enemy technological inferiority. Some prisoners began questioning whether similar medical technology might be available to German combat troops, potentially explaining German military effectiveness through superior medical support rather than simply tactical or strategic advantages. The nursing staff within the German medical facility operated according to professional standards that bewildered Russian prisoners. Accustomed to military medical care delivered by hastily trained soldiers with minimal specialized knowledge, German nurses wore crisp white uniforms that were changed daily, maintained detailed patient records, and followed systematic protocols for medication administration, wound care, and patient monitoring that exceeded anything the Russians had encountered in Soviet military hospitals. Unlike Soviet field medics, who were typically combat soldiers assigned medical duties based on availability rather than training, German medical nurses demonstrated specialized knowledge about patient care, medication effects, and recovery procedures. They moved through the wards with quiet efficiency, checking on patients at regular intervals, adjusting treatments based on observed improvements or complications, and maintaining detailed written records of each patient's progress throughout their recovery period. Volkov observed the gentle manner in which German nurses approached patient care, speaking softly even when language barriers prevented direct communication, using gestures and facial expressions to convey reassurance rather than the brusque efficiency he had experienced from Soviet medical personnel operating under combat pressure. The nurses seemed genuinely concerned about patient comfort, adjusting pillows, providing additional blankets, and ensuring that meals were served at appropriate temperatures and times. The systematic approach to medication administration impressed Russian prisoners who had grown accustomed to receiving whatever pills or liquids were available, often without explanation of their purpose or proper dosage instructions. German nurses consulted patient charts before dispensing any medication, measured doses precisely using graduated containers, and recorded each administration with timestamps and dosage information that created comprehensive medical records for future reference. Patient hygiene became another area where German nursing standards exceeded Russian expectations. Nurses assisted with daily washing routines, changed bandages according to specific schedules rather than when convenient, and maintained bed linens with a frequency that seemed almost obsessive to soldiers accustomed to sleeping in the same clothes for weeks during combat operations. The attention to cleanliness extended beyond medical necessity to what appeared to be genuine concern for patient dignity and comfort. The nursing staff's professional demeanor challenged Russian assumptions about German military personnel and their treatment of enemy prisoners. Soviet propaganda had characterized German soldiers as brutal and dehumanizing, yet these medical professionals displayed compassion and competence that contradicted those narratives. Nurses treated Russian prisoners with the same care and attention they presumably provided to German patients, suggesting systematic medical protocols rather than discriminatory treatment based on nationality. Communication barriers created initial difficulties, but German nurses developed effective methods for overcoming language differences through visual demonstrations, simple gestures, and basic Russian phrases learned specifically for patient care purposes. This effort to communicate with enemy prisoners impressed Russians who had expected minimal attention to their needs and concerns during captivity. The hierarchical structure of German medical care became apparent as Russian prisoners observed interactions between nurses, doctors, and medical orderlies. Each position carried specific responsibilities and authority levels, with clear chains of command that ensured efficient medical operations even under the pressures of wartime conditions. This systematic organization contrasted with Soviet medical arrangements, where roles were often improvised based on available personnel and immediate needs. Historians debate whether German nursing standards reflected broader cultural attitudes toward medical care, or specific military policies regarding prisoner treatment designed to maintain productive workforce capabilities. Evidence from prisoner testimonies suggests that German medical facilities maintained consistent professional standards regardless of patient nationality, indicating systematic approaches to medical care rather than preferential treatment for specific groups. The psychological comfort provided by professional nursing care created unexpected emotional responses among Russian prisoners who had prepared themselves for harsh treatment and neglect. Men who had expected brutality instead encountered compassion, professional competence, and genuine concern for their welfare that challenged fundamental assumptions about enemy behavior and German military culture. The introduction to German pain management techniques revolutionized Russian prisoners' understanding of medical treatment possibilities. Volkov's first encounter with manufactured painkillers came when a German nurse approached his bedside, carrying a small white tablet and a glass of clean water, explaining through gestures that the medication would reduce his discomfort. Having spent weeks enduring constant pain from his infected shoulder wound, the sergeant accepted the tablet with skepticism, expecting minimal relief based on his experience with Soviet pain management methods. Within 30 minutes of taking the German painkiller, Volkov experienced something unprecedented in his military medical history: the complete absence of pain without the clouding effects of alcohol, or the temporary numbness achieved by chewing on leather straps during surgical procedures. The medication provided targeted relief that allowed him to think clearly, sleep peacefully, and participate in conversations without the constant distraction of throbbing wounds that had dominated his consciousness for weeks. German medical staff administered pain medications according to precise schedules designed to maintain consistent relief throughout the recovery process. Unlike Soviet battlefield medicine, where pain relief was considered a luxury reserved for the most severe cases, German protocols treated pain management as an essential component of medical care that accelerated healing and improved patient outcomes. Russian prisoners observed nurses dispensing medications at regular intervals, maintaining detailed records of dosages and patient responses. The variety of pain management options available in the German facility amazed Russian soldiers who had grown accustomed to a single approach, enduring discomfort through willpower and occasional alcohol consumption. German medics possessed different medications for various types of pain, topical treatments for surface wounds, injectable solutions for severe discomfort, and oral medications for ongoing pain management that could be adjusted based on individual patient needs and recovery progress. Surgical procedures under German medical care included sophisticated anesthesia protocols that eliminated consciousness and pain memory, allowing complex operations to be performed without patient trauma. Russian prisoners who underwent surgery reported no recollection of the procedures themselves, awakening to find their wounds properly treated and bandaged without having experienced the agony that typically accompanied Soviet battlefield surgery performed under primitive conditions. The psychological impact of effective pain management extended beyond immediate physical relief to influence prisoner morale and recovery attitudes. Russians who had previously resigned themselves to constant discomfort discovered that healing could proceed without suffering, that medical treatment could actually improve their quality of life rather than simply preventing death. This revelation challenged cultural assumptions about the relationship between pain and healing that had been reinforced through years of inadequate Soviet medical care. German medical philosophy appeared to treat pain as a problem to be solved rather than a condition to be endured, representing a fundamental difference in approach to patient care. Medical staff actively monitored patient comfort levels, adjusted medication dosages based on individual responses, and sought to minimize discomfort throughout the treatment and recovery process. This systematic attention to pain management suggested resources and priorities that differed significantly from Soviet medical practices. Historians continue to analyze whether German pain management superiority resulted from pharmaceutical manufacturing capabilities, different medical training emphases, or cultural attitudes toward suffering and medical care. Evidence from prisoner testimonies indicates that German medical facilities maintained abundant supplies of manufactured medications, suggesting industrial capacity dedicated to producing medical supplies rather than improvising treatments from available materials. The contrast became particularly evident when Russian prisoners shared stories of Soviet medical experiences where wounded soldiers were expected to demonstrate stoicism and endurance by accepting pain without complaint. German medical staff actively sought to eliminate patient discomfort, treating pain relief as a medical necessity rather than a character weakness that undermined military discipline and ideological commitment. Some prisoners began questioning whether superior pain management might contribute to German military effectiveness by ensuring that wounded soldiers could return to duty more quickly and with less long-term physical and psychological trauma from medical treatment experiences. The recovery ward conditions within the German medical facility challenged every expectation Russian prisoners held about captivity and medical care during wartime. Individual beds equipped with clean white sheets, pillows, and wall blankets provided comfort levels that exceeded what many prisoners had experienced even in peacetime Soviet military barracks. Each bed included a small bedside table for personal items and a metal frame that could be adjusted to elevate injured limbs or provide better positioning for patient comfort during recovery. Meals served to recovering patients followed nutritional guidelines designed to support healing rather than simply provide minimum caloric requirements for survival. German medical staff prepared special diets for patients with different medical needs, offering soft foods for those recovering from surgery, increased protein portions for men healing from wounds, and vitamin supplements that were distributed according to systematic schedules designed to accelerate recovery processes. The ward maintained consistent temperatures through a heating system that provided warmth without the smoke and inconsistent heat sources typical of Soviet field hospitals. Windows allowed natural light during daylight hours, while electric lighting ensured adequate illumination for medical procedures and patient care during evening hours. This controlled environment created optimal conditions for healing that contrasted sharply with the harsh variable conditions Russian soldiers had grown accustomed to during their military service. Volkov observed the systematic patient care routines that governed daily life within the recovery ward. German medical staff conducted regular rounds at specific times, checking on each patient's condition, changing bandages according to medical schedules rather than convenience, and maintaining detailed records of recovery progress that guided treatment decisions. Patients received scheduled medication doses, physiotherapy exercises, and medical examinations that followed protocols designed to optimize healing outcomes. Personal hygiene facilities within the recovery ward included wash basins with running water, soap dispensers, and clean towels that were replaced regularly. Russian prisoners could maintain personal cleanliness throughout their recovery period, a luxury that had been impossible during combat operations where washing was limited to occasional opportunities with whatever water could be spared from drinking rations. The availability of basic hygiene supplies contributed significantly to patient morale and recovery speed. The ward's organization reflected German efficiency in medical logistics and patient management. Medical supplies were stored in designated locations throughout the facility, ensuring that nurses and doctors could access necessary materials quickly during emergencies or routine procedures. Patient charts were maintained at each bedside, providing immediate access to medical history and treatment records that guided ongoing care decisions. Social interaction among patients was encouraged rather than restricted, allowing Russian prisoners to support each other through shared experiences and conversations that helped maintain psychological well-being during recovery. German medical staff recognized the importance of morale and social connection in healing processes, permitting patients to move around the ward when medically appropriate and engage in quiet activities that supported mental health alongside physical recovery. The systematic approach to patient care extended to discharge procedures, where German medical staff ensured that recovering prisoners met specific health criteria before returning to regular prisoner populations. Medical examinations confirmed that wounds had healed properly, infections had been eliminated, and patients possessed sufficient strength to resume normal activities without risking medical complications that could require readmission to the facility. Historians debate whether German medical ward conditions represented standard military medical care or enhanced treatment designed to demonstrate German medical superiority to enemy prisoners. Evidence suggests that systematic patient care reflected established medical protocols rather than propaganda efforts, indicating that German military medical infrastructure had been developed with long-term strategic planning for managing wounded personnel effectively. The psychological impact of experiencing superior medical care created lasting impressions among Russian prisoners who had expected harsh treatment and neglect during captivity. Recovery ward conditions provided concrete evidence of German organizational capabilities and resource allocation that challenged Soviet narratives about enemy industrial and medical capabilities. The psychological transformation experienced by Russian prisoners extended far beyond physical healing, fundamentally challenging their understanding of German capabilities, Soviet military doctrine, and the nature of modern warfare itself. Volkov found himself questioning assumptions that had been reinforced through years of political education and military training, as the reality of German medical superiority contradicted everything he had been taught about enemy capabilities and intentions toward captured Soviet soldiers. Conversations among recovering prisoners revealed a common pattern of cognitive dissonance, as men struggled to reconcile their direct experiences with the propaganda narratives that had shaped their expectations of German treatment. Many prisoners admitted privately that they had expected execution, torture, or deliberate medical neglect, yet instead encountered medical care that exceeded anything they had received from their own military medical system during peacetime, let alone under combat conditions. The revelation that German medical resources were abundant enough to provide sophisticated care for enemy prisoners forced Russian soldiers to reconsider their assumptions about relative industrial capacity between the two nations. If Germany could afford to maintain such extensive medical facilities for prisoners of war, what level of medical support must be available to German combat troops? This question haunted many prisoners as they began to understand that superior medical care might contribute significantly to German military effectiveness. Soviet military doctrine had emphasized endurance, sacrifice, and the acceptance of hardship as essential characteristics of ideologically committed soldiers. The discovery that effective medical care could eliminate suffering while accelerating recovery challenged these core beliefs about the relationship between pain, healing, and military virtue. Some prisoners began questioning whether Soviet approaches to medical care reflected resource limitations rather than ideological superiority. The professional competence displayed by German medical staff created unexpected respect among Russian prisoners, who had been conditioned to view their captors as ideological enemies deserving only hatred and contempt. Witnessing skilled, compassionate medical treatment from enemy personnel complicated simplified narratives about German brutality and forced prisoners to acknowledge the humanity and professional capabilities of their captors. Language barriers initially prevented deep conversations between prisoners and German medical staff, but gradual communication through gestures, basic vocabulary, and shared medical experiences created unexpected human connections that transcended national and ideological boundaries. Russian prisoners discovered that German medics expressed genuine concern for patient welfare, took professional pride in successful treatments, and maintained medical ethics that prioritized healing over political considerations. The systematic organization of German medical care impressed prisoners who had grown accustomed to improvised, resource-constrained medical treatment under Soviet military conditions. The abundance of medical supplies, the systematic training of medical personnel, and the consistent application of treatment protocols suggested planning and resource allocation that reflected different national priorities regarding soldier welfare and military medical infrastructure. Historians continue to debate whether prisoner testimonies about German medical care reflect objective superiority or subjective comparisons influenced by the harsh conditions Russian soldiers had experienced during combat operations on the Eastern Front. Contemporary evidence suggests that German military medical systems had been developed with systematic planning and adequate resource allocation, while Soviet medical care had been compromised by rapid mobilization and chronic supply shortages. The psychological impact of experiencing superior enemy medical care created lasting effects that extended beyond the immediate captivity period. Many prisoners carried these experiences into post-war life, questioning official narratives about relative national capabilities and developing more nuanced understanding of the relationship between industrial capacity, military effectiveness, and soldier welfare in modern warfare. Some prisoners began wondering whether other aspects of German military organization might demonstrate similar superiority, leading to uncomfortable questions about Soviet claims regarding ideological and material advantages over capitalist military systems. These doubts, carefully concealed from authorities, represented significant challenges to the worldview that had sustained them through years of military service and ideological education. Years after the war's conclusion, when Russian prisoners had returned to their homeland and attempted to resume civilian lives, the memories of German medical care remained vivid and psychologically complex. Volkov, like many former prisoners, found himself reluctant to discuss his captivity experiences openly, knowing that Soviet authorities viewed any positive comments about German treatment as potential evidence of collaboration or ideological contamination that could result in persecution or re-imprisonment. The long-term implications of witnessing superior German medical capabilities extended beyond individual prisoner experiences to broader questions about Soviet industrial development and military priorities. Men who had experienced advanced medical technology, abundant pharmaceutical supplies, and systematic patient care began noticing deficiencies in Soviet civilian medical systems that had previously seemed acceptable or normal. The contrast between German prisoner medical facilities and Soviet civilian hospitals became an uncomfortable reminder of technological and organizational gaps. Private conversations among former prisoners revealed lasting psychological effects from their medical experiences in German captivity. Many admitted that the professional competence and humanitarian treatment they received from enemy medical personnel had challenged their fundamental assumptions about national superiority and ideological conflict. The discovery that political enemies could demonstrate genuine compassion and medical expertise created cognitive dissonance that persisted long after their repatriation to Soviet society. Some former prisoners maintained hygiene and health practices learned during their captivity, recognizing the practical benefits of systematic medical care and disease prevention. They taught family members about proper wound care, the importance of sterilization, and basic medical hygiene that had been demonstrated in German facilities. These practices, adopted quietly and without acknowledgement of their origins, represented lasting influences from their prisoner experiences. The comparative analysis between German and Soviet medical capabilities became a source of private doubt about official narratives regarding national achievements and technological progress. Former prisoners who had witnessed German medical efficiency firsthand found themselves questioning Soviet claims about industrial superiority and scientific advancement, particularly in medical technology and pharmaceutical manufacturing, where the contrasts had been most evident during their captivity. Historians examining prisoner testimonies decades later discovered that medical experiences often dominated personal narratives about captivity, overshadowing other aspects of prisoner of war life, such as work assignments, food rations, or living conditions. The profound impact of receiving unexpected medical care from enemy personnel created lasting memories that influenced former prisoners' perspectives on warfare, nationalism, and human nature throughout their post-war lives. The systematic documentation of prisoner medical treatment in German facilities provided historical evidence about relative medical capabilities during World War II, demonstrating significant disparities in medical resources, technology, and organizational approaches between the opposing military systems. These records challenged post-war Soviet narratives about German brutality toward prisoners while revealing uncomfortable truths about comparative medical standards. Contemporary medical historians continue to study the long-term psychological effects experienced by prisoners who received superior medical care from enemy personnel, examining how these experiences influenced their post-war attitudes toward authority, nationalism, and medical care. The testimonies provide valuable insights into the relationship between medical treatment and psychological resilience during extended captivity periods. The revelation that advanced medical care could be provided even to enemy prisoners during wartime demonstrated German industrial capacity and organizational efficiency that many Russian soldiers had underestimated before their capture. This recognition contributed to broader understanding of German military effectiveness that extended beyond tactical or strategic factors to include systematic support infrastructure that sustained military operations. If you enjoyed uncovering this forgotten chapter of wartime medical history, please like the video and subscribe to explore more hidden stories from World War II. Share your location and local time in the comments. It's fascinating to see where these historical revelations reach around the globe. Until we meet again in the next episode, remember that history often holds surprises that challenge everything we thought we knew about the past.